Today with us we have Dr. Joel Charles discussing where we are at with COVID-19. How are you doing today?
I'm doing well. Thanks for asking.
Good. Well, and thanks for coming back down. I know a lot's been going on since we last chatted, and happy to hear what's going on.
Yeah, thanks for having me. I'm glad to be here. I think it's an important time to check in again. Last time we talked, we were really getting ready for this surge, which thankfully so far hasn't materialized. I think folks in the community, have been watching things going on elsewhere, like in New York, and seeing this really intense struggle happening in those places, and sort of seeing that calm down. People have now started to wonder, like, where do we go from here? And I think the answer is a little stressful for people. So just hoping to give people some clarity today, both kind of in the broader picture where things might head, but also what's going on locally here with VMH.
Yeah, can you talk about what's happening locally compared to what's happening nationally?
Yeah, absolutely. So first, I just want to go back to an analogy that we talked about before that helps people really understand this situation, which is to think about COVID-19 like a forest fire. And again, the idea is you have this forest fire and your goal is to protect the houses. And right now, the assumption is that half of that forest is going to burn, and your goal is to save the houses. And the only situation in which half of that forest doesn't burn is if we can make this thing burn slowly enough that a big heavy rain comes. And in this case, the rain would be like a vaccine. And people being close to each other is like a wind that's fanning the flames. So what we've done with physical distancing is it's essentially like the wind stopping, so the fire spreads more slowly, so we can do a better job of protecting the houses and hopefully keep the fire spreading slowly enough that the fire never makes it to half the forest until the heavy rain, or a vaccine essentially, arrives. Like I said, the physical distancing has sort of turned off the wind, and we've used that time that we bought, to sort of protect the houses that were already on fire. Two, to get very good at finding the embers to make sure we know where all of them are. Three, recruiting and training firefighters, which in this analogy are public health workers, all of which sort of gets us prepared to live in a world in which this fire is constantly burning and flaring up in different places. So if you apply that analogy to our local situation, I would say there's minimal fire in our valley and in the surrounding valleys, but the world is on fire right now. And if you look at the numbers, the fire, at least in the U.S., hasn't gotten any smaller. New York's fire has sort of tapered a little bit, but nationwide the fire hasn't really shrunk. So we're in this situation where we're feeling relatively good locally, but we need to be prepared.
I know we've got a lot more testing done. We've hit over 500 now. What are we doing to test?
That's a great question. So testing is one of the most important things we can do. Going back to that analogy, you can't fight a fire if you don't know where the fire is and where the hidden embers are. And so we're really glad that in the last couple of weeks we've gained the ability to test anyone who has symptoms. And that's really important for folks to know. We want people to call us, to call our respiratory clinic if they're having any respiratory symptoms, because we need to find out if they have COVID. So that's been really helpful to making sure that our sense of how much COVID we have in our area is accurate. There was a long time where we didn't have any cases, and folks were wondering, are we doing enough testing? And I would say we always want to be doing more testing. However, our amount of testing that we've been doing has always been on par with the surrounding communities. So the fact that we had less cases is accurate. Does that mean that we have a perfect understanding of how many cases we have? Not necessarily, but we're every day able to test more and more people and adding new categories of people we can test. So we're really thankful for that, and we're constantly pushing the envelope on that every day. So we really want people to know that we can test more and that it's constantly growing, and to not hold back on calling us if they think they need a test.
Yeah, and I've heard a lot about antibody testing. Can you explain a little bit what that is?
Yeah, so this is a little bit of a complicated subject, but there's a difference between finding the virus inside someone and finding its footprints, sort of like that the virus has been there. And so usually when we're talking about testing, we're talking about finding the virus, sort of catching it red-handed inside somebody. Um, Antibody testing is more like finding its footprints. So it's seeing that your immune system previously encountered that virus. And, there's this hope that by using antibody testing, you can do a number of things. One, figure out how many people in your area had it previously. Two, to sort of give people these immunity passes for moving about in public. And there's a lot of hope in that area, but, I want people to understand that there should be a lot of caution around this, which is that we don't fully know how well all these things work, and that how much COVID there is in an area impacts the accuracy of one of these tests. So first, we don't have a full understanding of how long people are immune from COVID-19 after they get it. So the idea that you can give people an immunity pass, like that needs to be better understood before we can fully do something like that. But also, the actual usefulness of the test of the antibody testing depends on how much COVID-19 you have in your area or had recently. So an analogy we talked about earlier is sort of this idea that if you're walking through a field looking for four-leaf clovers, even if you're very good at identifying four-leaf clovers, if the field barely has any four-leaf clovers in it, most of the clovers you're going to pick up are going to be three-leaf clovers. And that's sort of the analogy. You can have a super accurate antibody test, but ultimately, if most of the people in your community didn't have COVID-19, then you're going to get what we call false positives, where your test is positive, says the person had COVID-19, but they really didn't. And you obviously wouldn't want to tell that person, hey, go back to work. On the other hand, if you're in a field where there's actually like 20% or like 1/5 of the clovers are four-leaf clovers, then when you pick up a clover, it's probably going to be a four-leaf clover. So there's a point at which, an accurate test is not useful, and a point at which an accurate test is useful, and we have to figure out how to interpret those results. And that's what we're trained to do as health professionals, is that we're scientists who are using science to help the public. That's what we do. And so that hopefully gives listeners some kind of understanding of the complexity of these ideas and why we can't just 100% jump into that right now. But I do want to just really reemphasize to folks that we have a lot of testing available now to actually find the virus while it's in people, and that's the most important thing that we can be doing right now.
And as of Monday, we have 2 positive confirmed cases in Vernon County. What does that mean for the change of Vernon County in our day-to-day?
It doesn't really change much. We always expected we were going to get some cases, and we were actively preparing for that. To be totally honest, we expected to have more cases and sooner than we did. And the fact that we didn't is a testament to how much sacrifices local folks are making. From here forward, it's not really going to be a question about whether we have cases locally. It's going to be a question of how much and where they're happening. And so we're really entering a time where we all need to learn to live with COVID being present to varying degrees in our community, and figuring out how we change our behavior according to whether there's a little bit of COVID or whether there's a lot of COVID.
It was stated by the county that the first case of COVID-19 wasn't contracted by travel. So how does that mean? Does that mean it was through community spread?
Yeah, so really, essentially what community spread means is that there's COVID in the community, and a person can get it without necessarily having traveled. In some cases, they don't know where they've gotten it. And like we've talked about a couple times before, while travel can be a risk factor, just because you don't travel doesn't mean that you're not going to get the virus. And again, like we talked about a second ago, we increasingly are sort of living in a world where COVID is in the community potentially, and we need to learn how to live with that and to be as safe as possible, but also sort of do the things that we need to do to keep society running. And that's where, these things like testing, public health, contact tracing, all these things become so important.
So now that we've had 2 positive cases, what's done after they're confirmed?
Yeah, so there's sort of 2 parallel tracks. So one, VMH has set up a COVID management team using some of the best models nationwide on how to take care of these patients. So we have a team that's if a person is confirmed to have COVID, people from VMH are calling them every day to check in on them, see how they're doing, make sure they're not getting worse, make sure they're getting the care they need, because it's really important for us to catch it as soon as possible if they start getting worse. And so we're really lucky to have that team available to provide that excellent care for our patients, and that's what we've been doing so far. Secondly, the public health department calls the patient, and this is a really important piece because they need to find out, A, where the person got it to figure out if other people are at risk from that source, B, who has that person been in contact with to see if they may have given the virus to somebody else, and if that's potentially the case, then they call all those other people and give them recommendations on what they need to do. So typically a person who has COVID is going to go into isolation for a couple weeks, and then the county will take the responsibility for contacting anybody else in the community who may have been exposed to them and making sure that A, they're monitored and don't sort of spread it to other people, and also decide whether those other people need to be tested as well. This public health piece is really important. You know, a lot of people are talking about testing. It's sort of like going back to the fire analogy. What use is finding an ember if you don't have a firefighter to put that ember out? You know, you need both of them together.
So, on one hand, we're being told to stay home as much as possible, but on the other hand, as a patient, it seems that it would be really important to continue to take care of many underlying health conditions during this time. In what way is Vernon Memorial Hospital making it safer for patients to come into the clinics, pharmacies, and hospitals?
Yeah, it's a great question that a lot of people are increasingly thinking about our end and for the listeners. So when this all started, we didn't really know how hard this was going to hit, and thankfully, due to people's significant sacrifices, it hasn't hit hard yet. By their sacrifices, folks in the community essentially bought VMH time. We used that time to get the hospital ready for a surge, and to make sure we had enough testing and personal protective equipment, and to get our hospitals and clinics set up so we could continue to care for our patients with and without COVID. There's an important idea to understand here, which is that in terms of people who have symptoms of COVID, it's pretty easy to separate them from people who don't have symptoms of COVID, and we put all the systems in place to do that. There's also this idea of asymptomatic or pre-symptomatic transmission. So essentially the idea that somebody can get COVID and never have symptoms and give it to other people, or somebody who can give it to other people before they have symptoms. So that brings up the idea that there are people walking around in the community spreading COVID who don't look sick. And that's the harder one to prepare for. And so we have to set up systems for both of those. So thinking about both of those, the first thing we did is to make sure our staff don't get COVID from patients. In the case of patients who don't have any symptoms of COVID, that means doing sort of basic protective equipment like masks and eye protection. In the cases of patients who have COVID, it means a lot more aggressive equipment to protect our staff. The second piece is making sure our staff doesn't give COVID to patients. So the first thing is not having sick staff at work. So we're checking their temperatures when they walk in. We're having them monitor their symptoms. The second piece is that all staff are wearing masks and using eye protection. So make sure that if they had sort of asymptomatic COVID, that they wouldn't be spreading it. So the third piece here is making sure patients don't give it to each other, which essentially we're doing through physically separating patients. For the most part, not having patients wait in the waiting rooms, kind of rooming them directly, and so a number of different things like that. We put those systems in place in all the different locations in the hospital, whether that's the ER, inside the hospital, in surgery, in clinics. So we feel pretty good about the systems we have in place to keep everybody safe. There's no zero risk here, like I said, and it's really about sort of benefits versus the risks to a patient. We're actively thinking about what are the benefits that we're providing to patients through our care and deciding, is that greater than the risk that a patient would have in terms of contracting COVID? And so if your health teams recommends that you come in for a particular service, you can trust that we feel that it's worthwhile for you to come in. Because our local case numbers are low and because we've gotten all these safety measures in place, VMH is carefully expanding our in-person care. including certain elective procedures and clinic visits for people who have a high need but low risk from COVID.
So, if someone isn't comfortable coming into the clinics, is there a way to get in touch with you?
Absolutely. So, as always, we want people to call first. We do have virtual care systems, whether that's by phone or video. What we'd like folks to do is to just call us ahead of time, because there are some things where the care needs to happen in person. Either you need to be examined or you need a procedure. So we really want people to call if they have a need, and to trust us to work with them to figure out, does it make sense for you to get that care from home, or should you come in person? And if you have a need but are high risk for COVID, that maybe we delay that a little bit to a time when things are a little safer or where things are better prepared for that particular person.
The question on everyone's mind: how long are we going to have to physically distance ourselves throughout the community?
That's a $1 trillion question, I would say, and I don't think that anybody really has the answer to that. All we can provide is consistent criteria for what defines when things are safe, and that's essentially the hospitals need to be able to take care of their patients. We need to have enough testing for people who need the testing. We need to have enough public health infrastructure in place. The actual cases in a given area need to be going down. So those are kind of the four overarching things that society seems to be using to decide when things can open back up. Obviously, I want to sort of clarify here that it's not really my place to sort of say when things should be opening up. That's what we're relying on the state and the federal government for, and the county. But I also really want to acknowledge for folks how hard this situation is. I kind of think in some ways this situation is like late February, when winter has been dragging on and people are really ready for spring and everybody's kind of tired and frustrated. And it's sort of like we all just found out like winter is indefinitely continued and we don't know when it's going to end. And that's really hard for people, I want to acknowledge that it's mentally tiring to maintain this constant vigilance to protect yourself. That's tiring for people, and there's a lot of tendency to want to just be like, screw it, and push that to the side. I also want to acknowledge that this is sort of, for the same reasons, emotionally challenging for people, and it's important for people to acknowledge that and to reach out to each other for support, because people are at home with their kids. They feel like all of a sudden they're supposed to be teaching their kids, and they're learning how hard it is to be a teacher. At the same time, there's a lot of them are out of work. They don't know what's going to happen, how they're going to pay their rent. So people are really stressed right now, and I really want to acknowledge that. And obviously, I hope that things are done to protect those people, but also to say that I really hope that people reach out when they need support. And again, this has just really been a burden on people's lives. Like I said, a lot of people don't know how they're going to pay their rent. They don't know how they're going to pay their mortgages. And people are still making the sacrifices in this great time of uncertainty. They're still making the sacrifices to protect each other. And that is really moving for me as a healthcare provider, that people are paying a real price for this, but they're doing it to protect each other. But it's important for them to know that we're all still vulnerable. This is a biologic fact that we're dealing with. It's not something that we can debate away. Going back to our old analogy, the fire is still out there. The world is on fire. We still don't really know where all the embers are, and we still haven't recruited and trained enough firefighters. In our local context, I think that we feel confident in saying that the fire is quite small and we have a pretty good sense of where the fire is. So we feel comfortable, for example, at VMH, in very cautiously expanding some of our care. But everybody needs to maintain a constant vigilance that this could flare up. If it gets into a certain high density setting, like people are seeing in rural areas with meatpacking plants. And ultimately, the only way to control this, using the fire analogy, is to keep the wind down until a fire burns down, know where the embers are, recruit your firefighters until the rain comes. So switch into sort of COVID talk, really, that's, do social distancing until cases are dropping enough. You have enough testing, you have the public health workers available and trained until a vaccine or a cure is developed.
Where do you think things are heading in the future in the larger picture?
That's a great question. On a local level, it's hard to predict. It depends on a combination of luck, the preparation of our hospitals and public health folks, and the sacrifice of the public. Right now we have all three of those. We're getting lucky because this hasn't gotten into any high density settings. Our hospital and public health folks are doing an excellent job being prepared, and the public is making significant sacrifices to keep numbers low. In the long term, thinking nationwide, what we can expect is there to be variation in different places. Some places will have a little bit of COVID, some places will have a lot. And we sort of need to be prepared when we're in a setting with only a little bit of COVID that could change and we could have a lot. So we need to be constantly prepared for that possibility. It's important to know that there's no true isolation in a situation like this because we live in a connected society. So we could do a perfect job in our area, but if the surrounding areas have big outbreaks, or using the fire analogy, the next valley over is ablaze, we're going to be affected, and vice versa. So, we could stamp out all the embers in our valley, but if the next valley over has that fire, like I said, it could jump the ridge and burn us. That idea applies to counties within Wisconsin, it applies to states as a whole, and it applies to entire countries. That's why it's so important for all of us, everywhere on this planet, to take this seriously and work together. We live in a connected society, no matter how rural we live.
People are hopeful that we can use this experience to not bounce back to what we had before, but to bounce forward to something better.
Yeah, that's certainly something that I'm hopeful of. COVID has tested all the systems in our society, whether it's how we take care of sick people, how we get milk from farmers to customers, how people get their kids taken care of and educated. And COVID-19's direct and indirect impacts have been particularly harmful to people who are already the most vulnerable among us. But what makes me hopeful is that what I'm seeing is most people are willing to sacrifice to protect each other. And most people trust the scientists and the experts to give advice on what actually works to protect people. If we can harness those two things, people's inherent generosity and the expertise of the scientists and experts, then we can move forward into a society which works better for everyone. At least that's what I'm hoping for out of this.
Is there anything else you want to let people know?
Yeah, so some really important final messages, which are we have more testing. So if you're feeling sick, we want you to call us so you can get tested. Secondly, if you need care for anything else, we want you to call us. We'll let you know if it's better for you to receive care from home or to come in person. I also just really want to thank everybody for their sacrifice. People are taking this seriously, and I want them to keep taking this seriously, and I want them to keep trusting the experts who are using the science to tell us how we can all get out of this intact. I also want to acknowledge that this is going to be a long haul. And I recommend that people really think about that and prepare themselves mentally for that, both in terms of taking care of themselves and in taking care of each other.
Well, thank you for coming in today and giving us so much information. We really appreciate all of your work you're doing.
Yeah, absolutely. Thanks for having me, Ashley.
That was Dr. Joel Charles of Vernon Memorial Hospital. We want to remind you, if you begin experiencing the following symptoms of fever, cough, shortness of breath, chills, muscle pain, new loss of taste or smell, vomiting or diarrhea, and or sore throat, please call the VMH COVID nurse line at 637-4990. You can also call the Vernon County Human Services line at 637-5235 if you have any further concerns.